Hello, nursing students. My name is Miss Gabriel. Wow, Dr. Perez, what a beautiful day.
Isn't it wonderful outside? It is.
It is beautiful indeed. So today, nursing students, I want to talk to you about the common pitfalls that you need to avoid when you are answering NCLEX-style questions. Whether you are in nursing school right now or you are preparing for your NCLEX exam, I think those little tips that we are going to give to you will help you do much better when you are answering those NCLEX-style questions. Now, Dr. Perez, what would you say the first one of the most common pitfall is when students are answering NCLEX-style questions on a test?
Not reading the question correctly. And this is multifaceted. One specific area in not reading the question correctly is not seeing these words like hypo, hyper, pre, and post, which is crucial when answering a NCLEX-style question. For example, you have a patient who is post hip replacement, okay, coming out of surgery 2 hours ago, post. The priority will be different from those who had surgery like 2 weeks ago, 3 weeks ago, and even though it's still in the post-op area, but if you're 1 hour post-op versus 2 week post-op, there's a whole host of difference in what the nurse would look for. So if you're not looking at the hours, post-op 1 hour versus post-op 2 weeks, that is a big pitfall, a giant pit that a nursing student can fall into and will allow them not to get the question or answer the question correctly. So looking at this is vital. The pre, the post, the hyper, the hypo, the intra area. So these are some of the common mistakes that I've seen nursing students make.
Mm-hmm. Now, for me, last week I was teaching, for example, I give a test to my students, and a lot of them, they miss certain questions. And I'm like, how do you miss these questions? The problem was they were not reading the entire question. So when I see a topic, for example, let's say I'm a nursing student, I see a topic, I know the topic, I'm like, oh, I know this. Instead of reading the question that is being asked, I tell myself, oh, I know this topic, the answer is this. No, you don't want to do that, because yes, it is a topic that you know, but the question they are asking you, you need to make sure it's the right question and you understand the question and that you are answering the right question. Because if you're not answering the right question, you are going to miss the question and you're not going to have a good grade. So it's very important to read the question very carefully, make sure you understand the question, and then you answer the question.
You're so right about that, Ms. Reddit. I've heard this so often from students. I've seen this question before. Never. That's like suicide. Take each question independently of itself, because the topic may be the same, but as Ms. Renette pointed out, that the question they're asking may be different. Like, for example, the nurse is sitting at the nursing station and saw on the monitor VFib. The nurse run inside the room. What should the nurse do first? And the answer choices may be call the code,
check the monitor,
check for a pulse. And you may see this question again that says, the nurse is sitting at the nursing station. And by the way, the answer to that would be assess the patient, check for a pulse, right? And you see this question come. The nurse is sitting at the nursing station. On the monitor saw VFib. Upon entering the room, the patient is unresponsive. What should the nurse do first? So you can see the questions are very similar, but in this time the patient was unresponsive. So never ever answer a question based on the fact that you saw it somewhere else. Take that question independently, read it carefully in order to select the correct answer choice.
Okay, so those were the tips that we had for you for today, and this was brought to you by Nursing to the Network
and Danvers Nursing Institute.
If you want more of this and you would like to spend 6 weeks learning about test taking strategies to successfully pass the NCLEX exam, call us today at 954-825-6063. Or you can visit us online at nursingtutornetwork.com.
All right, we're looking forward in working with you.